I'd been traveling around Airbnb to Airbnb, ended up in Michigan with some friends, and all of this was happening. So I ended up renting a house for a month. And now I've been here for a year and a half. There's a part of me that's scared to go home to South Carolina because I hit the jackpot and found a doctor that has dealt with CIDP before. He diagnosed me in 3 visits, and I belong to several groups on Facebook and Reddit where people will go 10, 12, 15 years being misdiagnosed, taking all this Parkinson's medication for years on end with no relief, or being misdiagnosed as something else.
Yeah, Guillain-Barré is sometimes considered a similar diagnosis. Yeah.
Mm-hmm. Mm-hmm. So I didn't really have anybody to turn to. It was just kind of me. It was a tough pill to swallow. Once my doctor was so nonchalant about it when he explained to me what CIDP was. He's like, no problem. We'll get you on a treatment plan. You'll be fine. Have a great day. See ya. So I get back to this house I'm renting. And the first thing I did, and like I mentioned, I went on YouTube and I said, there has to be somebody with a testimonial or something that can tell me more about this. And like I said, the first video I saw was this gentleman saying that he went to bed, woke up the next morning, and he was paralyzed from the waist down and spent the next 2 years in the hospital learning to walk. The next person I saw started the day rather normal. By the end of the day, she was paralyzed from the neck down and spent the next couple of years in the hospital trying to get better. I don't think, as a man, I've never cried longer or harder in my life. That was a very scary time because and it wasn't me so much that I was thinking, my dogs are my kids, they're my life. And if I can't move, they suffer. It's whatever with me, but they certainly don't deserve that. It was a very tough pill to swallow, and it's very easy to fall into depression, especially when there's no quote unquote cure for it. And from everything I read, the most I can hope for is possibly remission. Receiving the IVIG treatments, and I said I got them every 4 weeks, they would last about 3 weeks. The symptoms would subside, but they wouldn't go away completely. In the last week, from week 3 to week 4, it's like it had worn off. So I would basically suffer through that last week until I got my next treatment. And once you receive the treatment, you have to be very careful for what you do for the next 24 to 48 hours, because if you do the wrong thing, you overexert yourself, it'll be the worst migraine you've ever had in your life. So anytime I received a treatment, I would go home, go to bed. That was it.
Yeah. The side effect profile on these IG infusions are quite extensive. And, blood clotting, renal failure, and just about everything else. Headaches, nausea, skin change. You read the side effects, and there's like 100 side effects. I mean, it's amazing. And I don't know if you experienced any of them. So it sounds like there was some efficacy with that for you, but so was the plan? When the insurance company said, "Hey, we're not going to do this anymore because it's too expensive," which it is. I mean, $80,000, $40,000, $20,000 every month or whatever it is just it is expensive. When we think about it, not any slight on you, but everybody else is paying for it. I mean, it goes to the insurance company's premium, but everybody in the United States pays for that medication. And thankfully, we can treat some people, but at some point, you wonder where the money comes from. So they said further testing is needed. So where did that go?
I had to go back and get more MRIs. Mm-hmm. I was very grateful that they did not ask me to get another spinal tap because
painful.
That was awful. I don't recommend that for anybody. Yeah. But that was it. And my neurologist really fought with them hard. He was certainly a tremendous advocate for me, and it took several months. January of 2022 was my last treatment before they denied me. They reapproved me again in April of 2022. So I had this chunk of time with nothing.
Let me ask you, I get maybe the neurologist is one that suggested the anti-inflammatory diet. Did he describe that diet to you? And what, because you mentioned keto, heavy vegetables, what was the diet that they actually suggested you put on? Because I'm actually surprised because most physicians don't mention anything about diet. I mean, so at least they said that. So what do they prescribe for you diet wise?
He said inflammation is your worst enemy at this point.
Mm-hmm.
A lot of foods cause inflammation. He said, I recommend you go on an anti-inflammatory diet as soon as possible. He didn't go further beyond that, but kind of having the background and, having done the things that I've done throughout my life, my first thought was keto. Mm-hmm. I hadn't previously had experience with any sort of carnivore diet or anything like that. And I barely even heard of it at that point, aside from a few podcasts and things. But yeah, that wasn't the best bet for me, really. It wasn't until I removed the vegetables that everything changed.
Interesting. And, I got to tell you, somebody, when I was in medical school, we went through all these different specialties. You rotate through all of them to get an experience. Neurology is one of the most depressing fields there is. Because there's literally almost nothing you can do to cure these people. I mean, everything they get is chronic progressive. Nothing cures them. They always have a bad outcome. I mean, it's sad to say with a neurologist. And you mentioned the EMG, nerve conduction velocity studies, or where they stick the pins all over your legs. I sent a lot of people for that, so I can tell the difference in there. So, well, let's talk about the period of time between January and April. You're off your meds. You can't get them. The insurance company's denied you. What happens during that period of time?
February 1st, I started essentially the lion diet. Mm-hmm. To remove anything that could possibly cause inflammation. Okay. Beef, water, and salt. That was it. By February 3rd, I had 0 symptoms of CIDP left.
Wow. 2 days. That's 2 days.
2 days.
Wow.
2 days.
Okay.
Now my calves are still paralyzed.
Okay.
But if that's as bad as it gets, I can live with that.
So let me just, prior to February 1st, your anti-inflammatory was a ketogenic diet with, I assume, not a bunch of shit, fairly clean, a bunch of vegetables. Is that what that was?
Yes, sir. Very, very clean.
Okay. And were you trying to actively get into ketosis, high fat, or how are you managing that?
I was doing high fat, medium protein, low carb. Mm-hmm. I wasn't particularly using the ketone strips. Mm-hmm. Never been 100% sure on those, but as far as I was concerned, I was in ketosis. Kind of the taste of your saliva kind of changes a bit from what I experienced in the past. Energy was high. I looked awful. So those were all the things that told me that it was working.
You looked awful. And then, you weren't eating like keto junk food products and stuff like that. It's fair to say it was a whole food, clean, ketogenic diet, lots of vegetables, very low carbohydrate. And I assume you're eating maybe some meat and fish and things like that, maybe, or where was your protein coming from?
Everything was whole food. I didn't want to risk something. I didn't want to risk, I guess, my body reacting to some ingredient that I was unaware of in say, a protein powder, maybe.
Okay.
Or a greens powder.
And did that help you at all going from, I don't know what your diet was previous to, what was your diet previous to keto then, or the keto diet? Was it still fairly clean?
Normal bodybuilding diet, high protein, medium to high carb, medium to low fat.
All right. So oatmeal, bananas, white rice, chicken breast, broccoli, that type of stuff, right? Yeah.
Red meat, 1 meal a day.
Okay.
Yeah, it was, I've always been a stickler for what I eat.
Yeah. And you weren't and not obese. I'm looking at you, you're a lean dude. I can tell about it. You weren't walking around with 30 pounds of, tire flab around your belly, right?
No. It, and the funny thing is my weight has only changed about 7 or 8 pounds, but my body composition is completely different.
Yeah. I mean, now they're going on to carnivore you're talking about. Is that
from when I went just my normal everyday diet to keto and then to carnivore? Okay. My weight didn't change too drastic.
Mhm.
Like I said, maybe 7 or 8 pounds, but my composition is completely different.